Hi, I'm Abby Phelps, and this is my fourth video going over an NAEPP. And we'll be going over the stepwise approach to managing asthma long term. Right, so assess control. So a lot of things vary from patient to patient. So first we're gonna start with step up if needed. So first check medication adherence, inhaler technique. So then using a spacer is an example, um, environmental control, and comorbidities. So basically, just how your patient's doing with medication, if they need to get a higher dosage or switch medications, and then step down if possible. So if their asthma has been well controlled for at least 3 months, then typically um, we will go down on their medication. So the age categories, you treat each age category differently. So 0 to 4 years, 5 to 11 years, and 12 and up. And we will be going over 12 and up mainly and how we go about their medications and whatnot. All right, so first off, 12 and older treatment, stepwise approach. So, um, intermediate, intermediate. Uh, our preferred treatment is a short-acting beta agonist. Typically, we'll start with that, and then there's no alternative treatment besides the SABA, but we'll typically give them that and then see how it goes for them. So, persistent asthma, the preferred treatment. So, there's different steps. So, step 2 is a low dose ICS, and then step 3, low dose ICS as well, plus a LABA or a medium dose ICS. Step 4 is a medium dose ICS plus a LABA. And then so those are steps 2, 3, and 4. And then we also have the alternative treatment. So step 2, I'm really bad at saying this word, cromolyn, LTRA or theophylline is for step 2. Step 3 is a low dose ICS plus either an LTRA or theophylline, or I also am bad at saying this word, Zoluten. Step 4, medium dose ICS as well, plus either LTRA, theophylline, or Zoluten. For allergic asthma patients, consider subcutaneous allergen immunotherapy for patients who have persistent allergic asthma. And then consider or consult with an asthma specialist if you need step 4 care or higher is required. And then consider consultation at step 3. So step 5 and step 6 are more severe patients. They're pretty similar to each other. So for step 5, you do a high dose inhaled corticosteroid, ALABA, and then consider Xolair for patients who have allergies. And for step 6, high dose inhaled corticosteroid, ALABA, and then additional, unlike step 5, you'll do an oral corticosteroid. And then you also consider Xolair for patients who have allergies. So quick relief medication. So your short-acting beta agonists as needed for symptoms. The intensity of treatment depends on the severity of symptoms, up to 3 treatments every 20 minutes as needed. Short course of oral systemic corticosteroids may be needed. One thing that you need to be cautious of is using a short-acting beta agonist greater than 2 days a week for symptom relief, not to prevent exercise-induced bronchospasm, but that generally indicates inadequate control and need to step up treatment. So if your patient is having those frequent exacerbations, their medication's not enough, and they have frequent hospital visits, etc., they need to step up on their treatment and consult with an asthma specialist. So, summary, the stepwise approach to long-term asthma management is crucial because it allows for personalized treatment plans that adapt to the individual's changing needs. With that, this is very important for your patients because you really don't want them to get any worse. And it's always, better for them not to have those reoccurrent hospital visits. By starting with the least intensive treatment necessary to control symptoms and then stepping up or stepping down, depending on how your patient is responding to that medication. Healthcare providers can effectively manage asthma while minimizing potential side effects and medication costs. This dynamic approach ensures that patients receive the right level of care at the right time, leading to better symptom control and reduced exacerbations and improved quality of life. All right, please excuse my dog snoring.